Well, thank you, Ruben and Alika, and everybody who's come. There's a lot of wisdom in this room, and I think it's very interesting, that Ruben and Alika have managed to sort of bring us all together like this, because one of the problems that I have observed over the past 20 years is that every disaster you see seems to be quite unique, and each time we're dealing with an N of one. And it's hard for us in the disaster science field to begin to generalize across disasters, much less share lessons. So even though I'm about to give you another N of one with my observations about Katrina, I think the question for all of us is really, what are the generalizable trends that we can begin to elicit from these? So Katrina was enormous, and the days before Katrina hit, this was the risk messaging that was coming out of the National Hurricane Center. And they are normally a very conservative bunch. And so when they say something like this, you know that it's going to be an enormous event. And it was, and it led to, in short order, my group deciding that we wanted to create a longitudinal cohort study in order to understand what the long-term effects were. So the devastation and destruction from Katrina still remains unmatched. It is, and at least for the moment, remains the most costly of disasters that we've experienced in this country. 1.5 million residents were displaced from the Gulf Coast, and they ended up being scattered to all the states, and it was the equivalent of the Dust Bowl, happening in just a matter of days. It also led to a very interesting experiment, by the way, by FEMA. They had so many displaced people who needed housing that they had to come up with some immediate response. And you can fault them for how they carried this out, and there are problems with the trailer program, but they ended up deploying 130,000 travel trailers and single-wide mobile homes in order to house people, and created sort of little mini communities along the way to try and address this enormous displacement. So from my perspective, just as from a researcher, at the time I was in New York running an HIV longitudinal study. I wanted to do what I could to help, and I had the wherewithal and the resources to do it because I had a research team, one that was quite accustomed to doing door-to-door work, longitudinal work. We had the data systems, and I ended up working with the Children's Health Fund, which was already beginning to deploy mobile medical units down in the Gulf to begin initiating a longitudinal study. And we had 3 objectives when we began. One is we wanted to develop this observational cohort study that would be representative of a displaced and greatly impacted population in both Louisiana and Mississippi. We wanted to make sure that the study we designed was going to be relevant to policymakers and public health officials, so it had to sort of operate on multiple levels as both a needs assessment that would have immediate, actionable data, as well as something that would contribute to the disaster field. And that was something that we wanted to do. We wanted to add to and develop the theoretical frameworks for understanding how disasters affect the health and well-being of populations. So very briefly, our sampling was a multi-stage cluster sample. It was a little bit different in Louisiana and Mississippi, in part because in Louisiana, essentially everybody was displaced. Every place we went to was so devastated that virtually everybody had been displaced, so we had to go find them in trailer parks and hotels. These were in the months after the hurricane. And in Mississippi, we had a mix. We had a mix of people who had been displaced to trailer parks, and we had people who were still living in their homes or in trailers in in their home, like in the front yard, let's say. And we ended up recruiting 1,079 households, randomly sampled, into our study. And these folks were representative of about 60 to 100,000 people who were displaced and heavily impacted by Hurricane Katrina. Kind of fast forward a few years, because we ended up, as I'll explain, we did several waves of data collection just as the Gulf Coast Child and Family Health Study. And we did 4 waves of data collection, and then we ended up coming together and forming essentially a partnership with 2 other large cohort studies, one of them out of Tulane, one of them out of Harvard. So Harvard had the risk study, Tulane had a study about Vietnamese Americans, that we each had a cohort, and they were very similar, and we would sort of bump into each other at conferences, and we would talk about it, and we decided we're going to combine our efforts. And so for the 5th wave of data collection for our study, we got NIH center funding, and it included, in fact, one of the attendees here, Narayan Sastry, who you're going to hear from tomorrow, who is also part of our team. The idea was to really begin to get an economy of scale now by bringing all of these cohorts together using common measures and common data collection. And so a little bit of nuts and bolts, we put together this essentially a center structure that allowed us to have a data collection core, a data management core. We were really sort of now using and taking advantage of each other's strengths as well. And it took a lot of money. And so this gives you a sense of how much it took. People don't often think about how expensive doing longitudinal cohort work is. I'm sure Ruben and Alika are thinking about this a lot. But this shows you how much it costs us for just the Gulf Coast Child and Family Health Study in the 5th wave of data collection. We had separated our cohort into quintiles, and essentially we sort of went at each quintile in turn, and you could see that it was essentially costing us on average about $350 per person just in the field cost, just field costs alone. Doesn't include the principal investigator cost, the data management costs back in the office, none of the back office stuff. This is just out there in the field finding a very transient and displaced population. And this is the result of paying all that money, which is we had remarkably good rates of retention. At each wave, we had somewhere between 75 and 87% retention of all eligible, which for those of you who have done longitudinal study work, those are pretty good numbers because we spent a lot of time and effort building the relationship with the people in this study, keeping close contact with them. And this is even sometimes being years in between going back to them. So based on all of this work, we developed this notion, this socio-ecological framework of disaster recovery that was going to inform all of our work. We developed this after the initial 2 waves of data collection. We had been thinking a lot about it. We had these ideas of the dose-response effect that disasters have on populations. We thought a lot about how we're going to measure long-term recovery, because even though it was still kind of early on, we were going back every year initially after the hurricane happened. And then we started extending it much longer till at the end it was like 15 years after the hurricane hit. And we were thinking the things that we wanted to make sure we picked up on and the things that seemed to make sense to us were these 5 elements of long-term recovery, which were economic stability, housing stability, physical and mental health, and social role adaptation. And the social role adaptation is really thinking about how individuals see themselves in their social settings and the identities they have and how they manage those changing identities. So imagine if you are a teacher in Louisiana and you get displaced to Mississippi or Texas or wherever, and you don't have a teaching license there, and you can't get a job there. And so your identity, which in the past when somebody asked you, well, tell me about yourself. Well, I'm a teacher. Well, now you're not a teacher. Now you're a victim. You're a survivor. You're a displaced person. You're a former teacher. You've got to start creating a new identity for yourself. And so that becomes a part of the recovery process. So we were thinking all 5 of these things are really part of long-term recovery. So we ended up testing that. We used structural equation modeling to take all the data we had on these factors, and we tried to build a model to see how well these 5 elements hung together in our cohort as measures of recovery. And they hung together really well as a model. But this is still an N of 1. This is the N of my cohort that I'm describing so far. And what you see when you look at this is that there are different contributions of each of these pieces to that recovery metric, to that recovery outcome. And in fact, mental health plays the greatest role, followed by stable housing. Interesting, economic stability did not play as large a role as I actually thought it was going to initially. So I'm going to take just a couple minutes to highlight 2 types of things that we looked at, because we've looked at many things across the 15 years of doing this study. I'm going to talk about return to stable housing, and I'm going to talk about kids and children in terms of their mental health and how they serve essentially as bellwethers of recovery. So first, we're going to take a look at housing. And when we look at our framework, we pick those items that are highlighted in red to focus on for this particular analysis. And we kept on going back to this framework. This was the utility for me, and what I always tell my students, you've got to start with a conceptual framework, because then it's easier for you to kind of frame your research question. So, we used our framework and said, okay, we're going to take pieces of that and see if we can understand how stable housing varies. And so we ended up doing a series of survival analyses. And the survival was how long it took, how many days it took to get into stable housing, given that you were displaced. And you could see that the median number of days to stable housing was 1,082. That is a long time. That's 3 years, is how long it took to get to stable housing. Towards the end of this presentation, I'm going to talk about what the policy implications are of that kind of a number. You could see that about 15% of our cohort were not displaced, so they're not really being included in this survival analysis. It's just among the 85% who were displaced. And of those, 18% of the whole cohort achieved their stable housing within 18 months, but then 2/3 of them achieved their stable housing after 18 months. And 18 months is a critical date that we're going to come back to. So, I should just go back for a second. So you could see the survival analysis there, and you could see that, at the tail, it was actually right-censored because there were people still unstably housed even at the time we were doing this. But, you could see right at the 50% mark, that's where is that 1,082 day point. So we began to look at whether there are differences, group or characteristic differences, that would explain why some people were in stable housing and others weren't. So we looked at race, ethnicity to see if there were any differences, and the answer was there were no differences by race, ethnicity. We looked at how damaged your house was. Was it catastrophically damaged, moderate damage, minor damage? That didn't really make a difference either. There was about the same amount of time to stable housing regardless. We looked at age, and now we started seeing some real differences. The younger you were, the longer you were going to be displaced. The older you were, the shorter you were going to be displaced. We looked at whether you were a homeowner or a renter, big time difference between the two. That's a difference of 700 days. That's a long time. That's almost 2 years difference between homeowners being able to be stably housed sooner than renters were. We looked at income. Obviously, that also made a difference. Those who were poor, longer time to stable housing. So all of that was sort of just, one aspect of trying to understand how do you use this sort of longitudinal data to begin to understand something about, one aspect of recovery, the housing aspect. So another thing that I'm going to look at briefly with you all are children. And so we start with this sort of glimpse of what was going on in New Orleans. And so just as a way to illustrate for ourselves what was happening in New Orleans, we took the kids who were born in 1996 through 1997, who should have been the graduating class of 2015, 10 years after Katrina. Those 7,500 kids or so who were born in New Orleans in 1996-97, they should have been in the graduating class, optimally. But what you see is before Katrina even hit, there's already a declining population trend. So also important to know that there were these declining population trends before Katrina hit. Then, obviously, you see the enormous difference when you get to 2005, and it takes a long time for the kids to come back, and they don't come back in total. They come back to, at most, 3/4 of the prior student population. Also noteworthy, though, is the difference between the kids in the private schools, private/parochial, and those in the public schools. It was the kids in the public schools that were displaced. The kids in the private and parochial, at least by number, were not. So you could already see from this that there are going to be some differences. We also knew that from our work, based on our survey data, that the kids were being left behind in class. So they weren't getting promoted from grade to grade, and they were beginning to fall further and further behind. So in 2 to 3 years after the hurricane, 1/3 of the kids were too old for their grade. And so we had heard this anecdotally, that there were 16-year-old kids in 8th grade classes, which is not a good thing for either the 16-year-old or the 12 and 13-year-olds in that 8th grade class. We knew that there were 160,000 kids that had been displaced for 3 or more months, many for many years. We knew that, as you saw before, the school enrollment in the 2 states were still 55,000 below hurricane rates. And we knew that this displacement was an ongoing exposure. These were sort of some of the high-level observations and metrics we saw when we looked at what kids' lives were like and how parents were thinking about things over time. So this is from our cohort data. So you could see that the percent living in trailers was actually, this was a good sign. It was going down. That's what you wanted to see over time. But the percent of parents not coping well, that's not really changing dramatically. The parents with mental health distress, it's a good sign, bad sign. The good sign is it's going down. The bad sign is it's still very high. 42% are still describing a great deal of mental health distress 4 or 5 years after the hurricane. Parents still felt their kids were not safe in school, and there was still a great deal of transiency. A lot of movement. I mean, having over half the kids moving in the year is an awful lot of movement. On average in the United States, about 15% of the population moves in any given year. So we took into account, this is a graphic of Uri Bronfenbrenner's ecological model of child development. And the bottom line to this, aside from the fact that I think it's kind of a cool-looking graphic, is that kids, in particular, are the product of so many different systems in their lives. Microsystems, mesosystems, macrosystems, chronosystems, policy systems. So they're being influenced by, things within themselves, but then certainly by their household, their parents, their schools, their friends, their parents' work environment or context. You can imagine, right? Everything is nested within the other. And so we wanted to test this, and we started by thinking we need a national data set or something for comparison because we have a fully exposed group, basically, or those people with variation of some exposure, but we don't have a non-exposed, unexposed group. And we wanted to be able to illuminate the systemic pathways. And the outcome variable we picked was serious emotional disturbance, which is a measure that has been used and has been validated. It's built on a 25-item validated scale, and it's something that we knew we could find in national data sets and that we had used with our cohort. And so we had two hypotheses. One was that disasters will lead to increased serious emotional disturbance among kids, and the second is that this will represent vulnerabilities in many of the social systems that protect them. And so using national health interview study data, we found essentially a comparison data set of 8,600 households with kids asking very much the same questions we had asked in our cohort study, and we merged them so that we would use essentially a comparison group to our kids. And what we found, we had this what we called the black box of Katrina exposure. And we saw that, yes, Katrina exposure was in fact related. They were 1.5 times as likely to have serious emotional disturbance, and we found other things which had an effect as well. The parents' mental health was certainly having an effect on the kids' mental health. Where you lived in terms of region of country did not. Poverty did make a difference. So at the very least, it answered our first hypothesis, which was, yes, it appears that Katrina had an impact on increasing serious emotional disturbance. Then we used our cohort data to sort of go deeper into it, and we try to understand what are the potential contributions, and we thought, well, various parental constraints, household stressors, physical disorder, and social disorder. And we were borrowing from this framework of ecometrics that had been developed by Raudenbush and Sampson when they were looking at youth delinquency in Chicago. And so we applied those ideas to understanding how our children were doing in the study. And I will save you the structural equation model, but at the end of the day, this is what we found. We found that there was, in fact, a variety of relationships, but not always in the ways that we thought it worked. There is still to this day a mystery to me when I look at neighborhood physical disorder and see that it has what's essentially a protective effect, meaning that the greater the physical disorder, the less the serious emotional disturbance was among kids. And lest you think this is only Katrina exceptional, I ran a cohort study after Hurricane Sandy, 1,000 households, and I found the same thing. And I honestly have no idea what it means. So we'll just skip that for now, and you can all tell me later what you think it means. The main findings, though, were that the household stressors accounted for the most effect. Parents had the greatest direct effect, obviously, on kids. Social disorder did have substantial and significant effects, and prior social adversity had less effect than we thought it did. So a lot was really focused on the kids and the social disorder. A lot was focused on the parents, I should say, and the social disorder in their neighborhoods. So now I want to just briefly mention a policy aspect of this. So I mentioned that we had done a Sandy study. And after the Katrina study, we had heard a lot and thought a lot about the role of community-based organizations in the communities that we were working with. Because we were in Louisiana and Mississippi in lots of different little communities, and you could see the groups that were working, and you could see how long it took to ramp up community-based efforts to help the impacted populations. And I'm not sure if it's that different nowadays, but it was up until very recently, and I think it still holds true that FEMA has essentially an 18-month timeline, and that goes with the community development block grant money and social services block grant money that is often used as specifically designated funding for disaster recovery, that it has a shelf life of about 18 months. So you could see what the funding cliff actually looks like here. This was from New Jersey and Hurricane Sandy, but you see the cliff building as the community-based organizations build more and more capacity to manage the need that is in the community. And then all of a sudden, at the 18-month time frame when that federal funding ends, there is a cliff. And a lot of that funding just stops. So it brings it back to the question, well, is 18 months enough time? Well, if you remember the time to stable housing, the answer is no, it wasn't enough time. At a minimum, they needed 36 months. So problem number one is the federal policy regulatory framework is not really in line with the actual experience of what people go through after a disaster. I mean, we replicate this too with mental health amongst kids and among adults, and it's not like all of a sudden after 18 months it just ends. Actually, what happens that we noticed is that mental health needs increase in the third year after the event. And it's, again, something that we saw replicated in other work that we've done. The other thing that we've been thinking about is how can we begin to generalize some of these findings? So one thing that we started playing around with was this notion of, can we find a set of common indicators to do almost like an econometric study and look at 10 years data prior to an event and 10 years data after an event to try and see, can you use that as a way to measure recovery and begin to compare across disasters? And so our first test case was Sandy, which its 10-year anniversary was back in 2023. So we went through and we started trying to get the data to compare. And I'm going to show you just one graph from the report, which was we looked at deaths of despair. And we were now comparing Katrina, Hurricane Harvey, and Hurricane Sandy. And within Hurricane Katrina, we actually split it between Louisiana and Mississippi, thinking that maybe there were differences in those two states. And deaths of despair, sort of a coinage from Case and Deaton, who wrote about this, are really the deaths that are due to overdose, alcoholism, suicide, drugs, poisoning. There have been secular trends over the years as the opioid crisis has hit of an increase in deaths of despair. So we had to account for the fact that there is going to be a rise. But what you see when you look at this, if you notice, there's the 0 point is the point of boom. That's when the event happened, whether the event was Hurricane Sandy, Harvey, or Katrina. And we look at 10 years prior, 10 years after. And it was only in Katrina, in both Louisiana and Mississippi, that we saw that increase, sharp increase in deaths of despair. We did not see that same increase. So, we take from this that maybe that really was an exceptional case. So, I think this is, these types of efforts are the beginnings of this sort of cross-disaster comparative work that we all need to engage in. Because here, we're going to be talking about the Maui wildfires, and you're going to hear about, one after another of these different disasters that some of us have engaged in. But this all has to be in service to understanding what are the bigger points, what are the things that we need to do in terms of policy, programming, support, community-based organizations, et cetera.